Good evening, everyone. Happy Monday. Hope everyone had a really good Monday. Just gonna wait a few minutes to see if anyone joins, and if not, we can just get started. Okay. Okay. All right, let's just go ahead and get started. So I'm sure you guys have seen my face before. My name is Ibukun, and I use she, her pronouns. During the past few months, with the Whitman-Walker community health team has been expanding its outreach efforts to the social media platform. So you've seen us talk about COVID, you've seen us talk about sexual health practices, access to care. We talked about social determinants of health. Another thing we do is we, showcase very important days in the LGBTQ community and as well as just in healthcare in general. So actually today we're going to be talking about Intersex Day of Remembrance, which is actually today, November 8th. So like I said, today is the Intersex Day of Remembrance, and I just really want to share more information that will help raise awareness as well as educate the community about intersex and what it means and how we can communicate with that community in a respectful manner. So today, Intersex Day of Remembrance is also known as Intersex Day of Solidarity. And this day marks the birthday of Herculine Barbin, who is a French intersex person. And essentially the goal of today is we're really just fighting for gender equality and independent bodily self-determination for people whose biological sex does not conform to the myth or stereotype that people are born strictly only male or female. So I'm sure we're all aware about the gender binary, which, says you're born a male if you have, a penis and this, and then you're female if you have a vagina. That's the gender binary that the society follows. And intersex individuals are people who don't fit into those categories perfectly, or the way society deems necessary for them to be one or the other. So intersex is a general term used for a variety of conditions in which a person is born with a reproductive or sexual anatomy that does not fit the typical definitions of male or female. So for a good example is a person could appear to be a female on the outside, but internally they might have male typical anatomy on the inside. Or a person could be born with genitals that seem to be in between the usual female and male types. So for example, a girl may be born with a noticeably large clitoris, or could be lacking a vaginal opening, or a boy could be born with a really small penis or a notably small penis, or a scrotum that is divided so that it is formed more like a labia. Or a person could be born with mosaic genetics, so that some of her cells have XX chromosomes and some of them have XY chromosomes. So the way I just kind of explained it to you was, just examples of the different ways a person could be defined as being an intersex individual. So though we speak about intersex as an inborn condition, intersex anatomy does not always show up at birth. So there's many situations where a person doesn't even know they have intersex anatomy until he or she, or they, or whatever pronouns they use, reach the age of puberty. Or, maybe the person finds themselves to be infertile as an adult, or when they do pass away and there's an autopsy done, then, they might find out, their family would find out that they had intersex anatomy. So it's very common for people to live and die without knowing that they have an intersex anatomy, as well as other people in their community knowing. So that's why it's really important That's why this day is actually really important, because it's important for us to be educated about just the variety between humans, and also remember that the gender binary often leaves people out and silences different individuals. So for example, an intersex individual does not fit clearly into the gender binary. So it's another way to just silence them and remove them from society. So now I just want to talk a little bit more about language and how to interact with people that are intersex, and really just remembering that we need to still remain respectful to these individuals. So the first thing I think is important for us is to respect. Respect in general is important. So this is respecting the person's pronouns, respecting their chosen names, respecting if they would like to proceed with a medical procedure or if they would not. There's different procedures that can be done if a person would like to fix whatever things they would like to fix. But also ultimately you need to remember that this decision is not yours, and it's not up to you to impose your opinion on intersex individuals. Another thing I think is important is try to remember or try not to make any assumptions. So this is not the time to assume someone's gender. Just like the example that I shared where it said a person could appear to be a female, and then internally they have male anatomy. In this situation, you don't want to assume what their gender is, because that's up to the person to tell you what gender they would like to, what gender they are. Another thing is advocating for the equality of individuals who don't fit in the gender binary. So for example, like today, we posted a infographic just sharing more information about what intersex is. We shared about how to talk, like communicating with people who are intersex. We also shared about different organizations all around that are doing the work and advocating for intersex individuals. So a day like today would be a perfect time for you to reshare that infographic and just really spread awareness. And you don't really know who you're educating by reposting and who you're standing up for, because like I said, some people don't even know they're intersex. You might not even know if someone is intersex, and they could be your closest of friends. We definitely think advocating for the equality of individuals who do not fit in the gender binary. And then the final thing, and I think is the most important, is if you do have the opportunity to interact with someone who is intersex, we do urge you to have conversations with them to learn more. But with this, we're not saying strictly rely on that to get your information. We still feel like it's important for you to do your own research and really just educate yourself and not put the burden on intersex individuals to always teach you about what intersex is. So unfortunately, Instagram has taken away the chat feature. I don't have it on my phone, so I can't even ask if anyone has any questions. But if you do have questions, please put them in the video after I've posted them, and I will go back and answer them. But before I go, I just want to say that thank you for, joining us today for these few minutes to talk about what intersex is. And I just want to mention that this is regarding the COVID-19 vaccines. If you've already been vaccinated, I just want to say congrats. You're definitely taking a step to protect yourself, your loved ones, and communities from illnesses. And we still urge you to continue wearing your mask, social distancing, quarantining, and just practicing the CDC guidelines regarding COVID safety. If you haven't been vaccinated and you are looking for an appointment, Whitman-Walker does offer the COVID-19 vaccine, and you can call us at 202-207-2480 to make an appointment. We have appointments available at both our Northwest location as well as our Southeast location. And if you're having problems reaching us, you can also, and if you live in the DMV area, we do have information about ways for you to get the vaccine depending on where you live. So if you live in DC, you can call 1-855 855-363-0333. If you live in Maryland, you can call 855-634-6829. And if you're in Virginia, you can call 877-829-4682. And if you haven't been vaccinated and you are not looking for an appointment, we still urge you and we recommend that you continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's important for you to have conversations with the people around you about, their COVID safety precautions, as well as, having conversations about who's vaccinated or not. So we just urge you to just continue wearing your mask. And if you ever want to talk to someone about, receiving the vaccine, any questions you have, please don't hesitate to reach out to anyone at Whitman-Walker. We're willing to talk to you, and you can call us again at 202-207-2480. And finally, we just want to say that we're active on our Instagram, Facebook, Twitter, and TikTok at Whitman-Walker. And you can also get more information by checking out our website, www.whitman-walker.org, for the most up-to-date information. And if you have any questions at all about our services, making an appointment for anything, please call us at 202-797-4439. So I hope everyone has a good rest of their Monday evening, and I will see you guys later this week. Have a good day. Bye.